Hi, my name is Nancy and I'm a respiratory therapist. This is my colleague Marina. Today we're going to talk about pulmonary rehabilitation and how it helps people with COPD. The video that you can watch will be, you can refer back to it and do the exercises and learn how to live better with COPD.
As Nancy said, my name is Marina. I'm a physiotherapist, also going to be talking to you in this video. The one thing we really want to stress is that with a lung condition, some people feel short of breath with day-to-day activities like getting dressed, bathing, going to the grocery store, and tend to limit how much activity they do to help reduce their shortness of breath. Unfortunately, this can actually increase how much shortness of breath you feel in your day-to-day life. As you use your muscles less, you get a little bit weaker, and those muscles need a little bit more oxygen to do the same activity, which increases how short of breath you feel. Fortunately, exercising regularly can help improve your feelings of shortness of breath by strengthening your muscles, including the muscle of your heart, to help improve your quality of life.
Always talk to your doctor before you start an exercise program. You have to make sure that exercise is safe for you. Your doctor may refer you to a pulmonary rehabilitation program or a healthy heart program. These programs are programs that include education and exercise to help you learn to live with your lung disease. Not every town has a COPD program, but you can develop an exercise program on your own at home. Sometimes your doctor may prescribe a medication for you called Ventolin or salbutamol. It's a little puffer like this. If you take it before your exercise, it may help you with your breathing.
There are three general types of exercise: aerobic, also called cardiovascular or cardio exercise, strengthening or resistance exercise, and stretching. I'll start by explaining what aerobic or cardio exercise is. It's an exercise where you're meant to get your heart rate up and keep it up there for a sustained amount of time. Cardiovascular exercise can include things like walking, cycling, dancing, swimming. They tend to be whole body exercises. We recommend that you try to get at least 3 days a week of cardiovascular exercise, working up to 30 minutes each session. If you're unable to do 30 minutes in one go, breaking it up into 10-minute sessions throughout the day can help you exercise while decreasing the amount of shortness of breath you feel at one time. When you start doing your cardio exercise, it's good to include a warm-up, which is anywhere from 2 to 5 minutes before your activity, and a cool down at the end of your activity for 2 to 5 minutes. It's also nice to try to increase the amount of cardiovascular exercise you do per session slowly, and that can be anything from adding a little bit more distance when you're going for a walk or adding an extra minute or two at the end of your exercise to increase the amount of time.
Strength training is another form of exercise that it is important to do. There are several ways to do strength training. One of the ways that you can do it is by using a weight or a TheraBand, which is a stretchy elastic band. If you don't have a weight or a TheraBand, you can even use soup cans to carry out strength training. It's important to do strength training with a day of rest in between so that your muscles can relax. So you should do strength training every other day. And this allows you to have a well-rounded exercise program. Strength training is very helpful to allow you to do things that you want to do more easily. If you're unfamiliar with strength training, you should get someone to show you how to do it, a physiotherapist or a trainer or a couple of very experienced people that can teach you how to do strength training properly.
Lastly, stretching is an exercise that's gentle enough to be done every day. It can help your muscles move better and help you breathe a little easier. It's also an exercise that you can use as part of your cool down after a workout to help relax your body after you've stressed it. Cardio exercise, strength training, and flexibility are all important components of your home exercise program. We ask that you try to get 3 days a week of cardiovascular exercise and strength training and try stretching every day. There's a few tips we want to make sure that you're aware of. Make sure that if you're feeling pain, exercise should be stopped and adapted so it's better suited for yourself. You should never feel pain during exercise. When starting a new exercise program, you might notice a little bit of muscle soreness for the following 1 to 2 days. It should be mild and it should decrease after 2 days. One important tip to remember is that you should never hold your breath during exercise. You should try to focus on your breathing in during easier parts of the exercise and breathing out when you're doing the hard parts of the strength training. The first exercise we're going to demonstrate are called wall squats. This exercise helps to strengthen the muscles in your legs and hips. Start by standing up straight with your back against a wall. Make sure your feet are pointing forward and are about a foot away from the wall. Keep your arms at your side. While standing, bend your knees a little and slide your back down the wall. Hold this position for a second or two, then move your back up the wall into your starting position. This is 1 repetition. Try to do at least another 2 of these, remembering to not hold your breath, trying to breathe in when you're bending your knees and breathing out when you're returning to your start position. Now we will move on to leg extensions. This exercise works to strengthen the muscles at the back of your legs and your hips. Stand up straight with your hands on a railing, a counter, or a very sturdy chair, and move one leg behind you without bending your knee. Try to hold this position for 1 second and then return your leg to the starting position. This is 1 repetition. Repeat this movement 2 more times and then repeat with your other leg. The next exercise we will go over is called a bicep curl. It's meant to strengthen the muscles you use for carrying groceries or lifting items at home. Start by sitting on a chair with your feet flat on the floor and your back straight against the backrest. Hold a weight in each hand by your side with your elbows straight. Take a deep breath in, and while breathing out, lift the weight to your shoulder. You can do 1 arm at a time if you prefer. Slowly lower the weight back down while breathing in. You've completed 1 repetition. Now try to repeat this movement at least another 2 more times. Finally, the last exercise we'll talk about is called wall push-ups. This will help strengthen the muscles at the back of your arms and your shoulders, which are useful for getting in and out of bed or up from a chair. Face a wall, keeping your feet shoulder width apart. Stand at an arm's length or a little bit further from the wall and place your palms flat against it, at about shoulder height with your hands shoulder width apart. Slowly bend your elbows and lower your body to the wall, pausing, and then return yourself back to an upright, straight arm position. Complete this exercise at least another 2 more times.
Ideally, you should exercise most days of the week for at least 30 minutes. You should exercise when you're feeling most energetic and an hour or more after you've had a meal. Exercise at your own pace and build up at your own speed as well. Remember that you want to exercise hard enough to be breathless and to sweat a little bit. You can try exercising longer without stopping, or you can practice breathing control exercises, which you can find in another video. If you feel that exercise is causing you to become uncomfortable, you may want to consult with your physician. Also, if you haven't been using your blue inhaler, you may try taking a puff or 2 of that before you start your exercise routine. Or you may wish to adjust the setting on your oxygen tank.
To make it easier, we've provided you with a chart that you may choose to follow, which outlines a week's schedule of exercise. As you can see, we have suggested 30 minutes of cardio at least 3 times a week and strength training on alternating days. If you're not able to do 30 minutes of cardio in 1 session, you can break it into 10-minute periods to give yourself a rest. Stretching is gentle enough to be done every day. For those unsure of what activity to do, look through the yellow box to find an activity that you'd like to perform for each exercise type, remembering to consult with your physician before starting a brand new exercise program. Before we leave you to exercise, we hope you'll remember these key points that we've covered today.
Exercise strengthens your muscles and will help you feel less short of breath. Confirm with your doctor that it's safe for you to exercise.
Exercise most days of the week for about 30 minutes and get at least 30 minutes of cardio 3 times per week, alternating your strength training days. Try to stretch every day.
Thank you for joining us today. We hope you're on your way to a healthier body and mind.
If you're looking for more information on pulmonary rehabilitation and exercise, please look to the accompanying pamphlet for this video.